Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, we are discussing colon cancer. Colorectal cancer is the third leading cause of cancer in males and the fourth in females in the U.S. It's most common in people over 50, but it can occur in younger people. Colon cancer is treatable and preventable if detected early. Doctors cannot stress enough the importance of regular screenings to prevent any polyps from becoming colon cancer. Dr. Emily Rivet with Henrico Doctors Hospital is joining us to talk about this since it's Colon Cancer Awareness Week. Thank you so much for joining us. What is colon cancer and how is it detected?
Colon cancer is a tumor that involves the large intestine, and it can cause symptoms like bleeding or blockage. Most people, though, don't have symptoms, so very often colon cancer can be detected on a test called colonoscopy.
How does it typically begin?
It begins as a tiny little growth or tumor that eventually grows bigger and becomes a cancer, invading into the wall of the intestine.
And that is why screening is so important. It's because you may not even experience some of the symptoms that you mentioned.
Correct.
What is it that's keeping people from having this colonoscopy?
You know, I find that people have a lot of reasons. I think the primary reason is usually that people are afraid of the prep process, the clean out process, or they're concerned that the procedure may be uncomfortable. But we find that after the procedure, people are always amazed by how easy it really actually is. We have a better prep now, and people are generally extremely comfortable during the procedure itself.
Who's most at risk?
Well, people who are over age 50 are the primary population that we worry about, and that's the population eligible for screening. But it's important to know that people even younger than 50 can develop colon and rectal cancer.
And talk about the survival rate. I would imagine it's really pretty high if you get the screenings early.
Correct. If detected early, colorectal cancer is a very treatable disease process, and people generally tend to have very good outcomes.
Any new advances in treating colon cancer? I guess the #1 treatment method would be surgery?
Correct. And as a surgeon, what I'm interested in really focus on is minimally invasive techniques for surgery for colon cancer.
All right. Dr. Rivet, thank you so much for coming and sharing your information with us. We appreciate it.